3. Hello, my name is Mike Capon, here doing a video OSCE for AUT for course Para 603. My student number is 0006310, and here today doing a respiratory assessment on a patient here, Mark. So, starting here, hello Mark, my name's Mike, I'm an intensive care paramedic, and I hear you've been a little bit short of breath today. Okay. Can I just confirm your last name, Mark?
Boyd.
Boyd, and what's your date of birth?
24th, 8th, 81.
Okay. Well, what's actually happened today?
Just being very short of breath.
Yep, okay. Is this normal for you? Do you normally get short of breath?
From time to time.
Okay. I noticed there's some inhalers here, Mark. Are these yours? Is this your medication?
Yes.
Yeah. And have you used this medication today?
Yes.
Yeah. Okay. So would you use this one every day?
Not every day.
No?
Do
Okay. And what about this one here, the blue one? Have you
Just
used
when I need it.
Okay. So how often have you used it today, do you think?
A few times.
Okay. So Mark, I hope you don't mind. I just need to get consent for me to ask you some more questions and just check over the body. Is that all right?
That's fine.
Okay. I'm just looking for things that might have caused this shortness of breath today. You're looking pretty good at the moment, so nice and relaxed. Well done. Are you happy with that position where you're at?
Yes.
You sort of look like you're holding your head up. Can we make you any more comfortable?
No, this is comfortable.
Okay. You don't want to shift a pillow or anything?
Nice.
That's fine. Okay. All right. Are you in any pain at the moment?
No.
No. So it's just the shortness of breath?
Yeah.
Okay. Is it when you're moving around, walking, doing stuff, or is the shortness of breath there basically when you're sitting on the couch doing nothing? Or?
On exertion, yeah.
On exertion. Okay. All right. So I'm just explaining to the camera what I'm doing. I'm picking up that Mark's talking well. He's able to speak in sentences rather than just words. He's not struggling for breath at the moment. I'm looking at his colour and perfusion. He's got a good perfusion around his chest, head, neck. He's not short of breath at the moment. We're not presenting short of breath, but we're going to further assess and see what's going on there. Okay, so nothing else in the environment has given me clues as to respiratory conditions such as oxygen, humidifiers and things. There's nothing like that here. But obviously I'm going to ask Mark if he does use anything like that. Mark, do you use a home oxygen set? No. Okay. And what have you been prescribed the medications for? Has your doctor said what's actually wrong?
No.
Asthma or COPD, anything like that?
Asthma.
Asthma? Okay. How long have you had asthma for?
Since childhood.
Okay. Okay, so do you mind if I check your pulse?
Yep.
Yep. Oh, good strong pulse there. I'm just going to check on the other side as well. Lovely. Good strong pulse. Do you feel any pain when you take a big deep breath? Can you take a big
Not at the moment.
No? Nice big deep. And what about when you move your arms around?
That's
Okay,
seems to be good
them
now.
up, that's good. And now take a big deep breath. Okay. All right, no problem.
No, that's fine. Yeah.
Okay, just relax again. Okay, Mark, the next thing I'd like to do is just actually push on your chest, just to see if anything causes any pain. Okay, so no pain in the middle here. I'm just going to press the sides. Okay, and I'm just going to press down on the front. Okay, and you take a nice deep breath for me. Lovely. Just relax. That's good. So good equal air entry bilaterally there on palpation. Now I'd like to auscultate and listen to the breath sounds. So at the moment I'm sort of focusing on the chest, shortness of breath, and we'll also look at some differential diagnoses to rule out other things. So Mark, what I'd like you to do is just breathe through your mouth. just normally, and I'm just going to move the stethoscope around your chest and listen to your lung sounds. Okay, so that sounded good. Equal air entry bilaterally. Vesicular breath sounds nothing advantageous. Mark, can I get you to sit forward and I'll just listen to your back there. And similar on the back. Mark, whilst you're sitting up, I'm just going to tap your back. Okay, is that all right?
That's fine.
Okay, and just sit back again. Relax. And I'm going to do the same on the front, okay? So I'm just going to tap up here. Just get my way down. And I'm just going to get under your arms here now. Side. Okay, great. I've just concussed the chest, no hyperresonance or hyporesonance, so happy there. So moving on, I've looked at Mark's jugular veins here. Nothing's overly engorged, all looking good. Going to move on, checking other differentials. So checking the skin for out, checking the legs. I won't take Mark's boots off, but we're going to check the ankles, check the legs, colour, warmth, sensation, edema, see if we've got any systemic edema going on there. Checking colour, capillary refill, checking for any clubbing of the fingers. We've checked the back, we've checked the chest, want to check the abdo now. So Mark, is it alright if I just palpate your tummy? So I'm going to start from one side and work my way to the other side, and again. So I'm trying to feel for any masses or anything abnormal, but also watching Mark's face to see if he grimaces at all. Okay, and yep, so there's no swelling, no ascites, there's no grimacing when I push. Any pain in your tummy? Okay. So next I want to, I've checked radial pulses. I just want to check your carotid pulses. Just make sure they're all right. Lovely. I've visualised as part of my assessment the trachea is in midline, but I just want to just lightly palpate the trachea now just to make sure it's all good. Any pain there? Right. Okay, so further questioning about causes of Mark's shortness of breath. We need to look at trauma. Has he been involved in any trauma? Car accidents, falling down steps. Looking at the differentials, we could be dealing with a respiratory problem. Mark has a history of asthma. He's been using his inhalers more. He clearly has a clear chest at the moment, so he's not wheezing, so we don't need to treat that at the moment. Other differentials we could look at: chest infection, PE, COPD. It could be cardiac related, MI, pericardial tamponade, acute pulmonary edema. It could be muscular, intercostal muscles. It could be trauma-related, fractured ribs, sternum, etc. So we would need to go through and rule out those sort of things as our differential diagnoses. I'm happy at the moment that Mark would be a status 3. We would get him in for further assessment and treatment if required. Okay, and that's it.